Hi, I'm Dr. Wayne Kwong at MD for Men. I'd like to start by saying welcome and thank you for joining us today. It's great seeing so many of you virtually taking the time to learn about an enlarged prostate and being proactive in thinking about your health. I hope you come away from this presentation with a better understanding of your prostate, what it means to have an enlarged prostate, also known as benign prostatic hyperplasia or BPH, and available treatment options. BPH is a very common condition that affects many men around the world, more than 42 million men just in the United States. What is your prostate and why does it matter? The prostate is a small gland that is about the size and shape of a walnut that is located below the neck of the bladder. The urethra, or the tube that carries urine, runs through the center of the prostate from the bladder through the penis, letting urine flow out of the body. The prostate is part of the male reproductive system. The main function of the prostate is to help make some of the fluid in the semen. There are a number of conditions that can affect the prostate. It's important to understand that having one of these conditions does not mean you will have another. For example, I often hear from patients that they believe having an enlarged prostate increases their risk of prostate cancer. This is, in fact, not true. BPH is a benign condition. It is not cancerous and is completely unrelated to prostate cancer. Prostatitis is when the prostate is inflamed. It can be caused by injury or bacteria. It typically affects men ages 50 and younger, whereas an enlarged prostate tends to occur in men 50 and older. When a male is born, the prostate is tiny. As testosterone levels rise during the puberty years, the prostate grows rapidly, doubling in size by about age 20. Growth typically slows down for the next 2 decades, and the prostate usually does not cause problems for many years. We see from this graphic that the prostate typically grows with each decade of life. As men age, the prostate can become larger. By age 60, 70% of all men have an enlarged prostate, and nearly 90% of men have an enlarged prostate by age 80. Let's talk about the significance of having an enlarged prostate and how this condition can impact your quality of life. BPH is the clinical term for having an enlarged prostate. As we already mentioned, it's a benign condition. It is not cancerous and is completely unrelated to prostate cancer. If you have BPH, it does not put you at a greater risk for prostate cancer. One reason some men may be confused about the link between BPH and prostate cancer is that men who report prostate symptoms often undergo a PSA test that helps doctors diagnose the cause of symptoms. High levels of prostate-specific antigen in your blood can be an indicator of prostate cancer. This test, commonly called PSA, is used primarily to screen for prostate cancer. However, it's important to know that BPH can also increase PSA levels, so determining what a high PSA score means can be complicated. A PSA test alone cannot tell you definitively whether a condition is benign or cancerous. Before you take the test, I do recommend that you talk to your doctor and see whether it is right for you. Here we see the difference between a normal and an enlarged prostate. As we can see from this illustration, when the prostate is enlarged, the urethra is squeezed, blocking the flow of urine from the bladder. Generally speaking, the symptoms you experience may not correlate exactly to the size of your prostate. Some men may experience very mild symptoms, while other men may notice more severe symptoms. What signs should you be on the lookout for if you suspect you may have an enlarged prostate? As you age, you may notice that you need to use the bathroom more frequently, both during the day and at night. For many men, waking up at night to use the bathroom can be the most bothersome symptom of BPH, and in many cases, it often affects spouses whose sleep may also be interrupted. You may find that your urinary stream is weak or slow, or you might find it difficult to start urinating. Some men find they cannot completely empty their bladders and experience a stopping and starting while voiding, and some may feel a sudden urgent need to urinate. BPH is the number one reason men visit a urologist. I see hundreds of men every year in my practice who are suffering with these symptoms. If you suspect you have BPH, you may already know that this condition can seriously impact a man's quality of life. In addition to feeling tired from interrupted sleep, you may find it difficult to travel. I've heard many men complain about needing to always sit in the aisle seat of an airplane and needing to get up to use the bathroom many times throughout a flight. Or for those traveling by car, there's the worry about finding rest stops and the inconvenience to others who are subjected to frequent bathroom breaks. Some men may avoid going to the movies or spending time with family or friends. Planning life around the nearest bathroom can make some men feel embarrassed or ashamed. It's very common for men to believe that symptoms of enlarged prostate are a normal and an inevitable part of the aging process that's simply meant to be accepted and tolerated. Many men wait a long time to finally get their symptoms evaluated by a doctor, but it's important to see a doctor because if BPH is allowed to progress unchecked, it can actually result in permanent bladder damage. Over time, the bladder may be compromised in its ability to hold urine. Untreated BPH also has the potential to lead to serious complications, ranging from urinary tract infections and stones in the bladder or kidney to urinary retention and kidney damage. In the case of acute urinary retention, patients may need emergency medical attention to avoid a life-threatening situation. How do we diagnose BPH? Well, it's pretty simple actually. The first step is to make an appointment with a urologist. That appointment could entail an office visit, or if your physician offers telehealth, it could be conducted by phone or video. Your doctor will begin by asking for a simple medical history and may administer the International Prostate Symptom Score Index to learn more about the severity of your urinary symptoms. During the appointment or in a follow-up visit, your doctor may conduct a physical exam that may include any of the following: a uroflowmetry test to measure how fast urine flows, a digital rectal exam, or a bladder scan. If your symptoms warrant it, your doctor may perform a transrectal ultrasound, for which you will need to take an enema to clean out the colon and urinate to empty the bladder as much as possible. Cystoscopy is a procedure that allows the urologist to view inside the urethra or bladder using a scope that is inserted through the urethra to determine the condition of the bladder. The International Prostate Symptom Score is based on a brief questionnaire that you can take from the comfort of home and then discuss it with your doctor during your appointment. The questionnaire consists of 8 short questions that determines a score that rates BPH symptoms on a scale from mild to severe. As you can see from the chart, if you score a 0 to 7 on the index, then your symptoms are likely mild in nature. On the other end of the index, if your score is between 20 to 35, then it's likely your symptoms are severe, and your urologist will want to discuss treatment options with you. There are a wide variety of treatments available for enlarged prostate. The sooner the condition is treated, the sooner a man can expect his quality of life to improve. Let's discuss those treatment options now. When determining the best option to treat your enlarged prostate, your doctor will take into account several factors, including the size of your prostate, your age, your desire to preserve sexual function, your overall health, and the severity of your symptoms. If your symptoms are tolerable and not dramatically impacting your quality of life, then you and your doctor may decide to postpone treatment and simply monitor your symptoms. This is called watchful waiting. It's a common misconception that medication is the only treatment for BPH, but it's easy to understand why this misconception exists. Most doctors suggest medications to their BPH patients more frequently than other treatment options. In my practice, I have found that the symptom relief from medications can sometimes be inadequate and temporary. and many BPH medications have potential unpleasant side effects, such as dizziness and headaches, as well as sexual side effects. For many men, these side effects are enough to cause them to stop taking their medications. In fact, the rate of men who discontinue taking BPH medications because of unpleasant side effects, as published in the New England Journal of Medicine, is about 27% after just 1 year of therapy. This is consistent with what we see in clinical practice. About 1 in every 4 men are unsatisfied with the effectiveness of their BPH medication. It's important to consider other newer treatment options. There is a range of minimally to moderately invasive options. Some involve tissue destruction with heat or steam or removal of prostate tissue altogether. The UroLift system is a minimally invasive treatment option that can be performed in a urologist's office and does not involve cutting, heat, or removal of tissue. I'll tell you more about the UroLift system in a few minutes. When making the decision about treatment options, it is important to understand the key differences to evaluate the short and long-term benefits of treatment options and other factors such as the recovery time, the need for a catheter, and convenience. We discussed some of the potential shortcomings of medication already. Water vapor therapy is a moderately invasive treatment that uses water vapor or steam to remove prostate tissue. Heat-based treatments, including water vapor therapy, are less invasive than surgical options and can be performed under local anesthesia. Water vapor therapy, a form of thermotherapy, provides moderate symptom relief for some patients. It is important to know that applying high heat to the prostate can cause tissue swelling and urinary symptoms during the healing period. There is also an incidence of ejaculatory dysfunction with thermotherapy procedures. During the recovery period, patients often need to have a catheter inserted into their bladder in order to void. On the surgical end of the treatment spectrum, TURP stands for transurethral resection of the prostate. TURP is a surgical procedure that involves removing prostate tissue. This procedure typically requires general anesthesia and the use of a catheter for several days after the procedure. TURP usually requires an overnight stay in the hospital. Many men find TURP to be very effective in relieving symptoms for a long time, but the procedure can also leave patients with permanent side effects, such as urinary incontinence and erectile dysfunction. We've briefly touched upon the UroLift system procedure. Now let's discuss it in greater detail. This treatment is a proven option for patients looking for an alternative to medications, major surgery, or procedures that involve cutting, heating, or removal of prostate tissue. The goal of the UroLift system treatment is to relieve symptoms so that you can get back to your life and resume your daily activities. What does it entail? The UroLift system is an outpatient procedure that can be done in an office setting while under local anesthesia. It is a minimally invasive procedure. A delivery device is placed into the obstructed urethra to access the enlarged prostate. Then, implants, deployed from the delivery device, are permanently placed to pull the tissue away from the urethra and hold it back, like tiebacks on a window curtain, creating a passageway that allows the urine to flow more freely. Typically, 4 to 6 implants are placed into the prostate. The length of time of the procedure will vary based on the patient's individual anatomy and the number of implants required. As you can see from this image, the implants that hold the obstructing prostatic lobes apart are quite small, smaller than the size of a dime. Each implant is made with materials commonly found in medical implants. The UroLift system has been commercially available in the US since it received FDA clearance in 2013. It has been studied in controlled clinical studies and through a real-world retrospective registry. I think it's important to mention that for men who wish to discontinue taking BPH medications, most patients who undergo the UroLift system do not require ongoing medication. and the clinical evidence demonstrating the benefits of the UroLift System procedure is significant. There are more than 25 peer-reviewed publications demonstrating that the procedure is safe and effective. For example, clinical studies have shown the UroLift System treatment does not cause new sustained instances of erectile or ejaculatory dysfunction. The same cannot always be said of other BPH therapies, such as TURP, laser-based procedures, or even medication. Preserving sexual function is very important to many men, and so this is why it is a consideration in deciding which treatment is preferred. Unlike medications that merely treat BPH symptoms, the UroLift system addresses the actual blockage as illustrated in these before and after images following a UroLift system procedure. As you can see from the image on the right, the urethra is unblocked, allowing urine to flow more easily. Of course, individual results vary. Some patients have described the results following a UroLift system procedure as a night and day difference. You can see why that could be an apt description based on these images of a patient's urethra before and after treatment with the UroLift system. What can you expect following a UroLift? After a procedure, patients typically return home the same day without a catheter. There is minimal downtime following treatment, and many patients experience symptom relief in as little as 2 weeks. The most common side effects are mild to moderate and include pain or burning with urination, blood in the urine, pelvic pain, an urgent need to urinate, and/or an inability to control the urge. Most of these side effects resolve within 2 to 4 weeks of the procedure. You may be wondering how long you can expect relief from this treatment. 5-year data from a randomized study shows the UroLift system offers durable relief for patients with BPH. The UroLift procedure has broad reimbursement coverage in the US. You'll want to check with your insurer to find out specifics. You may be responsible for a copay and/or deductible. Medicare across the country is routinely covering the UroLift system procedure. You will find more details about insurance coverage at urolift.com under the For Patients tab. Here is a testimonial from a patient who received the UroLift system procedure. He said, "The UroLift system was a game changer for me. My wife was right that I should see a urologist and that I didn't have to keep living with my bothersome BPH symptoms." I'm so pleased that I've been able to share this information about BPH and the UroLift system with you. It's really been a game changer for my patients. And it's really no wonder that more than 175,000 men around the world have chosen the UroLift system to treat their enlarged prostate symptoms. The recommended next steps, if you are interested in learning more, is to take the IPSS survey on urolift.com. Next, you should talk to your doctor to see if the UroLift system is right for you. If you have further questions, there are some great resources available to you by calling 888-309-1104. Thanks for joining us. I really enjoyed our time together. Have a fantastic day.